Corona kills, but we are talking the latest COVID-19 version of the coronaviruses such as SARS and MERS. And that kills just around 2%. Every life matters, but compare figures with the annual death toll from more common or commonly known forms of influenza in a bit. For now, it's stats on Iran. As of the 2nd of March, the count was 1,501 infected, 291 of whom recovered and were dismissed from hospital, and 66 dead. The death toll appears higher than 2% because Iran keeps track of severe cases. If not severe, the affliction is most likely to pass on as a cold or even unnoticed. That's in 75 to 80% of cases, according to doctors. If you're vulnerable, however, say elderly suffering from organ failure or diabetes, you best keep your contacts to a minimum. The do's and don'ts are quite simple, but in need of instruction and action by the government. So what is Iran doing to survive the coronavirus with all the lies spreading around foreign media channels and social media channels about this country and its case of corona? And how did this uninvited guest even get into the country? Stay with me, Leila Faramarzi, on Iran Today for answers. If anything can have taken Iran by surprise, that would indeed be the spread of the novel coronavirus, COVID-19 or NCP, novel coronavirus pneumonia. And that it did, which is why the name corona has stuck with the virus, which was earlier unknown and unnamed to the world. But when alerted to the danger, which is the high contagion of the fast-spreading flu, the country set out to do what it had to do. Uncharacteristically, uncautiously, it announced the outbreak in spite of political repercussions, in confidence something might and will be done about it. Dr. Jahanpur is spokesman for the Health Ministry, the latest media center. Is there any cure, and does Iran have access to it?
There's no definite treatment for it. The treatments currently in use are merely empirical. There were antiviral drugs earlier in the market which were used against such viruses. They were used to fight diseases like AIDS. Iranian pharmatherapists have conducted studies based on reports and case studies from virus-stricken nations. Then they have combined them with the findings of previous studies to develop a medication regime, which we know as drug cocktail. Ever since the first case was confirmed in Iran, we started testing our cocktail made of 5 drugs. Iranian companies are making all necessary substances. The initial findings of our case reports, which are not yet finalized and confirmed, show that the patients held at the ICU and CCU have shown improvement in their symptoms following administration of this cocktail. Some have been disconnected from the life support system. Some others have been discharged from ICU and have been taken to recovery wards.
And by Tuesday, the 3rd of March, a sweeping nationwide movement saw 300,000 companies or groups mobilized into the fight on corona. That's a novel initiative to the world, although China has been impressive in containing the contagion. As for the US, it experienced its first corona-related death as of the 29th of February. What President Trump called a hoax. Of course, he quickly made up for lack of care or awareness by extending his travel ban to the US, in this case from the US also. Iran would appropriately be a suitable target, as this would complete US sanctions on this country. Dr. Salehi is an infectious disease specialist who tells us of the outbreak's repercussions.
As you know, this virus and the news about it can affect the economy, the tourism, and some other areas. I think many countries around the world do not release the real death rate. And I believe that the number of the people who suffer from the coronavirus infection in Iran is not much different from the rest of the world.
Talking of sanctions, these haven't made things any easier for Iran by way of receiving diagnosis kits or hygienic equipment, actually by way of buying said equipment, because foreign companies want to be paid by conventional banking channels, and the all-round sanctions include banking transactions. So how have things been going in Iran?
We're prescribing some medicine here. I and my colleagues searched for the treatment around the world and found some medicine for helping out treatments like hydroxychloroquine and oseltamivir and others. We try to combine these medicines to help our patients, and I think we could succeed in curing many patients, fortunately.
Medical equipment can be brought into Iran customs-free via Anzali port in the north till end March, when the virus might die out with higher temperatures. At the same time, 3 production units in that locality are producing, say, disinfectants, hospital clothing gear and masks under the supervision of the Health Ministry. That is partly to make up for the hoarding of masks, disposable gloves and disinfectants by black market dealers and saboteurs. What's being done to provide more masks and antibacterial liquid and whatever else to the nation?
The first step we took was to call a halt to the previous distribution network. At present, only the Health Ministry makes every necessary purchase and distribute the commodities under a specific mechanism in various areas based on priorities, mainly hazardous groups or groups exposed to danger. It has already happened. We have started distributing this protective package containing a mask, disinfectant, and even brochures about COVID-19 in Qom. Now that I'm talking to you, hundreds of thousands of packages are being delivered by the national health networks.
It's all mostly for prevention and diagnosis, although Iran is also working on a cure and native diagnosis kits. Also, the Health Ministry has designated at least 230 hospitals across the country to treat coronavirus patients. That would be 1 hospital per city, except for bigger cities, with free treatment. The ministry has also been sending out frequent collective texts to give the nation medical tips on the outbreak. The IRGC has set up a corona prevention and confrontation base, and Iran's Pasteur Institute has received 52,800 kits donated by the WHO, World Health Organization, and 15,000 kits donated by China. This doesn't mean the country will stop working on manufacturing kits of its own as well as a cure.
Coronavirus, as you know, had been causing common cold for many decades. At the beginning of the 21st century, this virus genome changed into SARS. After 1 decade, it underwent another change and turned into MERS. It has mutated again. This novel coronavirus still can cause common cold these days, but in some patients it can cause more severe diseases.
Other measures have been closing capital city Tehran's snack shops and water fountains and subway stations, disinfecting buses and subway trains and public places, and announcing out-of-season school and university holidays. Holidays were not given earlier for reasons such as not all kids would stay at home but get taken shopping or on trips to make the most of holidays.
It seems that this novel virus differs from the previously identified viruses of this category. I've heard that this virus is not a live organism, it's a manipulated virus.
Many people who are out on the streets to go to a doctor's office or anywhere else may be infected. Vulnerable people like me, a pregnant woman, are likely to contract this disease. It's a neglectful decision to ignore those with weak symptoms.
We used to buy a package of 100 masks at a very low price, but now the price is 30 times higher. Moreover, it is hard to find masks.
I see some people who underestimate it as a common cold and don't take it seriously. I think the facts have to be said so that everyone would take it seriously. One issue that's not taken seriously now is the issue of quarantine.
Human experience of urban quarantine has not been successful. Placing a city under full quarantine is not necessarily a successful experience. I don't think even China is happy with its quarantine measures. Quarantine was limited to Wuhan. You see it nowhere else in China. In addition, our social structure management and even cultural structure totally differs from China's. Suppose that this virus emerged in New York. Would the US move to place it under quarantine? Or more generally, is full quarantine possible in the US? We believe that no single prescription could be given for this disease.
To cut down on hospital referrals, self-diagnosis is being encouraged. The Isfahan Medical Sciences University has set up a novel coronavirus self-diagnosis website. It begins with a test of 10 questions, basically residence, age, gender, medical history, and present symptoms such as fever, breathlessness, and fatigue. National emergency services receive 10 to 15,000 calls a day, but it is noteworthy 80% of patients are cured as outpatients and with rest. Only 20% are hospitalized. Time for a short break. We'll be back in no time. It would be far-fetched to think Iran had deliberately put off any necessary action, because several people in position here have contracted the coronavirus. One of them being the presidential deputy Masoumeh Ebtekar, another one being none other than the Health Ministry Deputy for Prevention of the Coronavirus himself, Iraj Harirchi. Also, 20 MPs have tested positive by March the 2nd, 2020. But where in the country did it all begin? The outbreak has centered mostly on Qom, a city of about 900,000 people, some 90 miles south of Tehran. But cases have spread to nearly all the country's 31 provinces. Mahane has been greatly blamed for the spread of the virus. It is rumored the flight that rescued Iranian students from corona-ridden Wuhan in China flew far and wide in Iran before decontamination, right after. Mr. Jafarzadeh acquits them. He is spokesman for the National Aviation Company. Would you say Mahane was unfairly criticized and even battered on social media?
An obligation was assigned to the Civil Aviation Organization to return Iranian students from China. But state media did not pay attention to the anxieties of those who had to return to Iran. We were not influenced by social media hype. Mahane was very cooperative in returning these passengers from China. Strict health measures were also introduced on crew members. There were also other health instructions, which were all respected on the flights. Accusations against Mahane are unfair.
We had dispatched a 57-member team to bring back Iranian nationals and students who were willing to return. We felt obliged to serve them, and we returned them under health protection measures. We first held them at a hotel in the suburbs of Tehran, to be far from residential areas. They were held in quarantine for 14 days, being visited twice a day. They were tested negative for COVID-19 and were discharged after being awarded health certificates.
Now, China is the epicenter where it all began in the world. That was end 2019. Altogether, some 60 countries are now touched by this latest of the crowned viruses. In spite of all this, a lot of the reaction Iran has been receiving makes it sound like the contagion started here, with potato cutlets and lamb. Due to the long latency of the virus, many carriers, unaware of their affliction, traveled to various locations, even abroad, which partially did lead to the spread of the contamination, but partially. Other countries in the region, including Afghanistan, Kuwait, Bahrain, and Iraq, have reported cases involving individuals coming from Iran. But that doesn't mean these neighbors are corona-free themselves.
If you see that in an area, economic hubs with many transactions, which may exist in our neighborhood, have shown no significant figures so far, you have to cast doubt on their data. Be sure that the country is frequented by thousands of merchants and tourists on a daily basis, have much higher figures. We hope that structures will be upgraded and figures become as transparent as Iran's. In case it does not happen, you will see soon an explosion of information. Cover-up cannot block the flow of data. That would happen in some countries in coming weeks.
Also, stations like Iran International tend to count how many Iranians travel to the next infected country. Thanks to maliciousness of the kind, neighbors such as Dubai, the UAE basically, wasted no time at closing their borders to Iranians. Whereas the Emirates is the transit point between Iran and the Far East. Let's see what the world's media have to say at large. For that I give you Shahrzad.
Hi, I'm Shahrzad Manucheri, and this is the news section of Iran Today. We'll be looking online for the latest update on the recent outbreak of coronavirus in Iran, facts versus falsehoods. The New Yorker investigates how Iran became a new epicenter of the coronavirus outbreak. Iran took steps this week to check the contagion spread. In Tehran, subways, cars were disinfected and snack shops were shut. In more than a dozen provinces, public venues such as college campuses, schools, and cultural centers were closed. Events drawing large audiences, including soccer games and movie screenings, were postponed. Friday prayers were canceled in the 24 provinces where the virus has appeared. In an article by CNBC, we see that the World Health Organization says coronavirus entered Iran undetected and warns outbreak could be worse than is known. This disease came unseen and undetected into Iran, so the extent of infection may be broader than what we are seeing. Dr. Mike Ryan, Executive Director of the World Health Organization's Emergency Programs, told reporters at a news conference at the agency's headquarters in Geneva. The focus of the outbreak has shifted from containing the outbreak in China to understanding how the virus is spreading across the world, WHO Director General Tedros Adhanom Ghebreyesus said. "We are at a decisive point," he said. "The epidemics in the Islamic Republic of Iran, Italy, and the Republic of Korea demonstrate what this virus is capable of." That's all for this segment. We'll see you next week.
The UAE is in fact the first country in West Asia to record the outbreak of the corona, although it has been tight-lipped since. But given the volume of incoming and outgoing passengers and East Asian workers and traders, it is unlikely that the number of those infected would be low. Leaked information put the Emirates' Friday toll at 80 infected and 18 dead. Saudi Arabia also, with its fair share of Far Asian expats, must have a fair share of corona victims.
Let me describe the situation of some countries around Iran these days. Most of them don't have any equipment or device for detecting this virus. And unfortunately, I should say, many of these countries don't even have a healthcare system. They can't even specify the number of infected people. For example, the healthcare system in Pakistan and Iraq are much inferior to that of Iran. In Iran, there are many labs which try to test this virus and other viruses, and our healthcare system is able to check this virus and give report to the World Health Organization every day.
The Saudi Center for Disease Control and Prevention outrightly denied any cases of the novel coronavirus, whereas India's Minister of State for External Affairs said an Indian nurse working at a hospital in southwestern Saudi Arabia had been infected by the coronavirus and was being treated. Iranophobia with regard to corona has become an issue even in Iraq and Turkey, never mind Persian Gulf states. US networks in Iraq will have worked on this. Compared to its neighbors, Iran is isolated. On the contrary, Turkey is a hub, connecting flights to the farthest reaches of Europe, and its flights to China continue, as do the UAE's. Pakistan and Afghanistan, on the other hand, are direct neighbors of China, with limp border checks and frequent travel by land to China. By poisoning mines towards Iran, the US and allies are completing sanctions impact, while at the same time cutting off Iran's connections by land and air and portraying this country as a liability. This is in spite of the fact that Iran has high scientific potential, and a fine medical ranking. Testament to this capability are medical tourists pouring in. Mr. Jafarzadeh, spokesman for the National Aviation Company, he feels Mahan Air was unfairly criticized for endangering the country with continued flights.
If I remember well, the health minister said the patient zero was a merchant who had used the indirect flights to China. Mahan Air had direct flights to China. They had no fear to say that, for example, this flight had brought the virus into Iran. I don't intend to pass the buck. Legal channels have to be exhausted. But on social media, there are unfounded analysis. We have to obey the specialized studies about the virus transmission.
Social media release conflicting news. We have friends and foes everywhere. We should not just rely on whatever we hear and copy and paste it. That would cause chaos in the society and harm every one of us.
In third world nations, rumors are spread easily. The Ebola was much killer than the coronavirus, but there was not so much media hype.
Foreign news channels such as BBC want to exploit the situation and weaken people's morale. If they are honest, they should offer solutions to us. It would be of no help to say so many people have been killed by this virus.
I prefer to receive news from IRIB rather than from social media. I don't trust most of foreign news outlets. Someone from outside Iran may want to create chaos in the country and make the people troubled.
Under stressful conditions caused by an epidemic or contamination, such things are seen in most societies. Our country is more specific because it seems that certain hands are at work to stir up trouble in Iran. I don't raise any conspiracy theories, but I have to acknowledge facts. Many fake IDs using hidden IPs to spread fake news about the spread of COVID-19 in Iran have been examined. They're mostly located outside Iran. It indicates that certain factors are instigating rumors.
What's the aviation organization done to control the spread of the coronavirus via airspace and travelers?
Such health supervision is done at Imam Khomeini Airport. All airports are on full alert. Health ministry teams are stationed at airports. All the passengers are checked so that if any suspected case is found, necessary health measures would be taken. Every necessary medical measure is done at the airport.
To compare COVID-19 to the common flu, according to WHO, the flu causes up to 5 million cases of severe illness globally and kills up to 650,000 people annually. In the US, on the other hand, the Center for Disease Control and Prevention, CDC, estimates that so far there have been at least 15 million flu cases for the 2019-2020 cold season, as well as 140,000 hospitalizations and 8,200 deaths. There have been 54 reported flu-related pediatric deaths from influenza B viruses alone. In comparison, the coronavirus pales in its destructive capabilities. Worldwide, it killed a mere 3,069 and infected 89,798 people by Monday.
Relying on our experience from China, this disease seems to be spreading faster than flu. However, it seems to be less of a killer than similar diseases we have seen in other countries in previous years.
That is not to downplay the potency of the new coronavirus. But in all its ferocity, our greatest enemy right now is not the virus itself. It is fear, rumors, and stigma. Those were words spoken by Ghebreyesus, the WHO Director General, at a media briefing on 28 February. Together, we are powerful, he said. Containment starts with you. In standing together, don't touch your face, wash your hands frequently, drink a little water constantly to wash the virus down into the acidic stomach, and stand at a meter's distance from others, and you should be okay. Moving on to a corona-free world in the Persian New Year is the probability predicted. See you then and before. I also hope to receive your comments. Bye for now.